Welcome to the Human Capital Innovations Podcast, your go-to source for personal, professional, and organizational growth and development. We hope you tune in often for all things people management, organizational development and change, organizational leadership, and social impact related. Maximize your personal and organizational potential with Human Capital Innovations Podcast. Welcome to the Human Capital Innovations Podcast. In this HCI podcast episode, HCI Research Associate Dr. Leandra Hernandez and her colleagues continue their weekly COVID-19 Convo via Facebook Live to discuss all things COVID-19 related.
Okay, so I don't know about y'all, but right around Easter, we live on a major basically the closest thing to a highway that Spokane has. We live right on it, so I can see sort of the traffic daily. And it kicked up so much right around Easter, and I'm not gonna say the hyperbolic thing I was gonna say. I am very concerned about people just out living their lives right now. What are you seeing? Oh, there's Pamela.
Well, if it makes you feel any better, Kari, I think here it seems to be the opposite reaction. I feel like people are just starting to kind of be inside. Today I went for a jog, and normally I have to dodge people, and today I saw 0 people on my jog. So people must be.
That's good.
Yeah.
I don't know. I feel like people here just don't care at all.
Really?
Not anymore. I mean, for a while it was doing great, and so far the hospitals in Spokane are doing great, not nearly as bad as anyone thought. And then it just seems like once they announced that, the governor said it, then everybody got too cavalier.
Mm-hmm. Yeah.
And I don't know if you have anything, maybe you could speak to that a little bit, Leah. There's such an interesting problem of health communication, letting people know that what they're doing isn't pointless. Mm-hmm. But then the concern that telling everybody that things are looking so much better has risks as well.
Yeah, it's kind of a double-edged sword, right? From a fear or a hysteria perspective, because on the one hand, it's so important to actually disseminate the information to show that we have progress, treatments are working, social distancing is working, right? But then when that information is co-opted by individuals, either to justify them not following through with the mandates, or when it's used by more well-intentioned individuals to kind of just say, hey, things are a little bit better now, life can go back to normal. That's when I really start to think about the role of fear appeals and whether or not they work, because a lot of persuasion literature and risk and crisis comm literature talks about the pros and the perils of fear appeals, right? We don't like being scared into doing things, but then the question just comes down to really how do we frame that to tell people there is progress, but not also to say we don't need it anymore, right? And I've been thinking about this a lot within the Texas context, and Governor Abbott and a lot of the other politicians coming out and saying, we want to reopen the state. And as someone who has family members in small business context, I'm concerned for their health. I'm concerned for the health of their fellow employees. And then I'm also really concerned for all of the individuals in Houston who are especially angered by Lina Hidalgo's mandate to wear masks. Because now in the city of Houston, if you're seen outside without a mask, you could get fined up to $1,000. So people on a lot of different channels I'm seeing in Houston are losing their minds about that mandate and the fine. And I'm also thinking about individuals with mental health concerns or disabilities who may not understand why they need to wear the mask and then how that plays out. So that was a really long stream of consciousness answer.
No, that was great.
But this is what I've been thinking about all week.
So, Leon, what is the opposition to a fear appeal? I mean, I understand there's a reason-based appeal, and that's not working so well with a lot of folks, in part because there's been a lot of disinformation out there. So you can't use your reason unless you have some facts to exercise it on. But the appeals from, protect your fellow man, this sort of altruistic appeal doesn't seem to have quite the same legs as the fear appeal.
Yeah, so like on the one hand, we think about so many campaigns that have used fear appeals effectively, right? Like a lot of the anti-smoking campaigns that show individuals with tracheotomies, or they show black lungs. But I think one of the concerns with fear appeals in a COVID context is that, like, what kind of images do you use in that moment to stimulate that fear appeal? Is it an individual in a body bag? Is it an individual in a hospital room or a respirator? And really, at the end of the day, I think what's competing here with the feel appeal is really the individualistic call to arms, if you will, right? For individuals to not be limited or regulated, and certainly not fined.
Yeah, I wonder, I was thinking about what appeals seem like they work the best on people, and sometimes it's like social media reinforcement, but it's so, for some groups, that's a thing, right? Like people, I mean, I'll admit it for myself. I was sewing masks, and I posted that I was sewing masks because I wanted all the positive reinforcement from my friends. Yeah, because I could mail them to them. But there's always that element of like, oh, I want people to tell me I'm doing a good job. And I think in my social media circle, that's something I'm going to get lots of reinforcement for, or showing yourself, a selfie where you're out with your mask on and your gloves or whatever. Like, but in some people's social media circles, saying, my body, my rights, or something.
Weird co-optation of that rhetoric.
I was just going to circle back to science communication. I've been doing a lot of work with an engineering team out of the University of Nebraska on trying to increase public awareness of antibiotic resistance. And so we've done a lot of research in science communication, more in Leah's field for that. And a lot of the studies we've been looking at suggest that scientific literacy is not the problem. So when we scream but the data at people, actually most people in this day and age are surprisingly scientifically literate. And instead, what we found is that people are social, and they're going to pick the things that reinforce group bonds that they already have. So if the people around them, if they get that positive reinforcement from saying, you're not going to infringe on my rights, that's what they're going to do. The evidence isn't the question.
Right. Yeah. And the confirmation bias of cherry picking evidence as well, especially when there's conflicting facts, being spread.
Yeah. And there's so many risk crisis persuasion theories that have that strong social norms component, right? Because Kari, I think you nailed it. Individuals are brilliant. They're smart. They know how to read this information from all of these different outlets. But I think what's the most significant factor, as we're starting to see play out, is maybe not necessarily the information literacy, but more so the social normative function, right? Like, I'm wearing masks because I know they're important, but more so because my mom mailed me 10 of them, right? And
girl, legit, the other day I was driving out to get something, and I called my mom just because I missed her. I don't know if she's watching, but she was like, "Where's your mask?" And I wasn't going to do it that day. And I know better, but I just didn't want to wear the mask. And then she told me to do it, so I did it.
Exactly. Thanks, Mom.
I know.
I wonder what would, if it's about identity, given where we are in the trajectory of the kind of, yelling from one side to the other, is there a way to design, for example, a campaign which would tie identity on the right wing to, say, wearing masks?
Yeah.
Like your
That has
flag
been a-
mask, your Second Amendment mask, your, hopefully
Right.
not a white peak tat mask, but I mean, something.
Yeah. That's what I was thinking about, that there's this weird complication in this. And it just feels like this whole sort of like galaxy of elements came together to create this situation where caring about public health is tied to the left wing.
Mm-hmm.
But I don't think that that's always been true. I mean, we can think of lots of historical epidemics where it goes the other way, right? Like it's not necessarily true, but in this case, now so many of these terms, even like social distancing, for example, I think has started to have a partisan ring to it.
Yeah.
And I think there's probably people who are hesitant to do things because they don't want to get kickback from people on their social media networks or in their families, or, people who are in communities or social groups that are primarily right-wing identified. They might actually hesitate, even if they were persuaded, even if they actually wanted to wear a mask, maybe they're not wearing a mask because of that.
I'm working on that paper I told you all about for American literature. And I did a big study. I did a lot of reading last week about American versus British receptions of germ theory. There's sort of a narrative that America was later to the game, and that's apparently not true. But I read some really compelling arguments that America was different in the uses to which it put germ theory, insofar as, exactly as you say, Jen, even if the British were doing this with a paternalistic attitude towards the poor, they were still dealing with disease as social infrastructure problems that the government needed to take a role in. Whereas, according to this author, Charles Allen McCoy, he's at SUNY Plattsburgh, I think, he said that America was always more of a militaristic model of medical discourse. And I don't know what Lorenzo would say about that. I think he would say that the British did that too. But that they always tended more towards individualistic practices, such as neoliberal mandates, like it's on you to be clean, and quarantines, such as we saw with Typhoid Mary Mallon.
Mm-hmm.
I wonder what you guys think about that. I found it very interesting, and I've been chewing on the idea.
Yeah.
Of course, none of us, Pamela and Jen and I were all British scholars, but we are Americans, so we're allowed to talk about both, right?
That's true.
Don't tell any Americans I said that.
Yeah. Y'all know I think about culture and identity way too much, right? Way too much. And Kari, I think your point and Jen's point go together so well when we think about it along political lines, but also cultural lines, right? Even now, after so many years of being in health communication, I still keep trying to rectify how all of these pieces put together at a larger public health perspective, right? It's like the idea of social distancing shouldn't be seen as a partisan issue, but it's kind of evolved as such, right? It shouldn't necessarily perhaps be seen as a racial ethnic health disparities issue, but it's absolutely evolving as such, particularly in a lot of the memes we've been seeing on Facebook about what sort of body can wear a mask without fear of, all sorts of problematic things. And then also what sorts of bodies are the bodies that are doing the labor. There was also a different set of memes I saw playing out this week in terms of protesting. So protesting as an American right, a citizen right, also a sometimes militarized action or right, and the types of bodies that can do these protests without, again, the fear of some sort of problematic retribution. So I don't know if that necessarily answered your question, but that's what I thought of with both of y'all's thoughts together.
Well, the other thing I've been thinking about, actually, Pamela, you've written a book about this.
What hasn't Pamela written a book about?
Well, I was thinking about the cholera in the religion stuff with cholera. when I was seeing, because I saw this interview, I'm sure many of you saw this interview of this woman saying, you know, coming out of church, and she's being interviewed by a reporter, and he's like,
covered
like,
in Jesus.
how would you risk this? And she's like, I'm covered in the blood of Christ. I'm covered in the blood of Christ. Like, as if that means you can't get sick. And which my quite religious parents disputed the theological basis of. But
I just can't not think of bloodborne pathogens when somebody says that.
yeah, it's like, think of all the things you'd be opening yourself up to. Don't cover yourself in anyone's blood. But I was just thinking about the, I mean, because if I recall correctly, there was some people tried to read cholera as a religious condemnation, right? And like, you weren't supposed to do any public health because it was sort of a judgment from God. And
Right.
but I don't remember exactly, because I'm just trying to recall reading the book that you wrote. So I'll ask you, Pamela.
Right. Well, I mean, not everyone thought this, of course, but there was a small sort of wing of folks who said this is clearly a judgment from God, and immediately attached that to all the political things that they didn't like. Like, you thought about recognizing Catholics in Parliament, judgment of God. People were outside enjoying themselves on the Sabbath, judgment of God, right? So, and of course, at the same time in France, they were saying, oh, it's because we've moved away from the Catholic Church. So, it's a perfect example of people saying that the epidemic operates in some completely different way in our country than it does everywhere else, right? Like, in those places, it may not be, but in our country, it's moving away from Protestantism. So God is apparently very selective about how these things work out. But what's kind of most interesting about that is that you're in a time at the beginning of the century where the church really speaks for the nation. You have a state church, an established church. And doctors are really private individuals, and health is a private matter.
Yeah.
And through the medium of this, of the cholera epidemics, I argue, basically over the period from 1832 through the 1850s, doctors move into being public figures with a public health mandate who can speak for this, what is now conceived of as a political and national concern, which was not earlier. I was thinking about, because I realized, as we were talking about this the other day, I think you may have seen this on Facebook, Kari, or on Twitter. It was like, I've never really studied virology because viruses are really not a thing in the 19th century and the period that I'm most focused on. And so, I was kind of asking some really basic questions. And then I thought, okay, so, germ theory, the great age of germ theory, sort of the late 19th century, and then virology, really, it starts to be sort of discovered in the late 19th century, but it really comes into its own with the electron microscope. But we really turn toward there are germs and we should kill them. Kill the germ. The germ is bad, kill the germ. And that leads me back, Jen, to what you were saying about, having this kind of us and them attitude toward pathogens, when of course pathogens have been with us for a really long time. And reading some of the virology, I mean, that there are viruses that cause illnesses, but also have protective effects. And I thought about the way that, under earlier models of medicine, when someone was sick, you said, oh, there's an imbalance, we're going to strengthen the body. And then we discovered germs and we're like, oh no, the problem is this germ. And we're going to kill the thing. And if we kill it inside your body and we have to kill you to do it, hey, them's the breaks. But actually, we're finally now turning again toward an idea of that we are, a system. And it's about strengthening the system, and not about isolating and killing the one thing in the ecology that isn't right. And immunotherapy really kind of returns us in some ways to an earlier way of thinking about the body.
Oh, that's so smart. I love that.
I have
nothing to add. It's just awesome.
all the lost opportunities for thinking about immunotherapy, you know, back when they discovered that, oh, hey, if people get erysipelas, that will sometimes cure their lymphoma, right? Mm-hmm. And then, oh, X-rays, shiny object. And so we never followed that out. And we lost 80 years or whatever it was, 70.
I just heard someone, I'm going to see if I can find the name of the person, talking about this on the podcast This Week in Virology, which is a great podcast if you haven't listened to it. I just released a new episode, so I'll be listening to that later. But can I click on this? Okay, Kostya Chumakov is the person who was talking about it, but he was talking about the differences between different types of polio vaccines, and basically putting forth a theory that a particular type of polio vaccine, and I'm not going to get the details of this right because I don't know that much about virology, but it was something to do with the difference between like attenuated virus. It's called OPV, but I don't know. I guess it's just oral polio vaccine, but it uses a different method. And I think it's like the difference between attenuated virus or like, you know, I don't know the difference between different types of vaccines, but it was stimulating some kind of immune response. His hypothesis is that it's stimulating a kind of immune response that actually is protective against other diseases besides polio, and that they were seeing lower rates of other viruses among people who were getting that type of polio vaccine, which was mostly used in the USSR and is still used in Russia, I believe, compared to people who were getting a newer type of vaccine, which had been seen as safer because it was like farther away from giving someone the actual virus, but maybe didn't have this kind of bonus effect, you know? So it was making me think about just like the way that the body operates as this really complex ecology. And when we do one thing, we don't always know all the things. Like we can't precision locate a germ and kill it most of the time, I guess. We're always kind of adding and subtracting, and there is still this level of balance that even though we like to make fun of, you know, humorology, like the humors and that way of thinking about the body, it actually isn't, at least metaphorically, it still works for us.
Well, and one thing I often tell my students in medical humanities courses is if we just assume that every way that we're viewing things, every epistemology is obviously right, and everything that's come before us or exists in different geographical spaces is backwards, then we're prone to the errors that we can now see in the past. So only by saying that this could be something at play can we protect better against those oversights.
But then that gets back to the whole problem of communication, of, you know, how do you, it's a lot harder to convince someone or to get grant money or whatnot when you say this could be a factor.
Right.
Versus this is the answer, right?
Yeah. And you don't know what you don't know yet, right? And I think that's so much of the uncertainty at the public level now, because we know like, hey, social distancing is working and all of these other preventative and reactive measures are working, but then you see discourses playing out about vaccines and funding and where the vaccines are coming from. And I remember seeing articles not too long ago about how some of the tests and the vaccines that came out of the CDC were infected. And then that one article, which is such a smaller subset of this massively large discourse about coronavirus, then just spirals out of control with
viral.
With the fear and the hypocrisy and everything else. And I think what we're seeing here, in addition to all of these other factors, is really uncertainty management working or not working and then spiraling, right?
Right. One of the most terrifying things I think about the virus is that, you know, even though so many people have died from it, we really don't have a handle on, what the actual effects are, right? We're now seeing people talking about blood clots, and we're seeing, amputations and kidney damage, and it's hard to have it. And then there are all these asymptomatic people, and what's up with that?
I don't need a mask. I don't have the symptoms. It doesn't matter. I can do what I want.
Right. But also, I mean, they're asymptomatic, but they're infected. So does that mean that they will have damage later on down the line, even though, or does it mean they're not,
Yeah. Yes.
Yeah.
We don't know. Yeah, it is. I mean, it's so hard it makes it very easy for people who are trying to downplay or discredit science in general. When there is this degree of uncertainty and there aren't certain answers, and people do have to keep revising as we go.
Right. When 1 week it's like we need ventilators, and the next week it's like, oh no, we need dialysis.
Yeah.
And just, I think, again, I just keep returning to this idea that, and I include myself in this statement, that especially in America, we're shockingly not used to the idea that we can't just, the things we want or need won't just be available.
Mm-hmm.
I think I fell into this a bit earlier on, where there were some people that were like, cool, like, well, we'll get a vaccine. And even I had to be like, oh, wait, like, you can't just have a vaccine. Like, humans have to make it and test it. And I've even heard that with ventilators. Some of the conversations have been like, okay, we'll get ventilators. And as you say, that's not really the discourse anymore. But then I heard one person eventually say, like, you can't just have a ventilator. You've got to have oxygen taps, and you've got to have a type of bed that these things don't just pop out of nowhere. And I feel like I keep getting called out by circumstances that show me that I fall victim to that thinking as well.
Right. I mean, especially with things that we think of as being really quotidian and easy and insignificant, like swabs. Who knew that swabs would be the weak link for so many tests? But swabs have to be made somewhere, and it turns out most of them are made in Italy.
I know.
And you think, well, we've got cotton, we've got sticks. How hard can it be?
Yeah.
Put it together. There you go.
Yeah.
Well, speaking of big ecologies, big ecological systems that are more complex than we always are capable of grasping, the global economy is one of them. We don't know all the factors.
Absolutely.
Yeah.
Mm-hmm.
Absolutely. And the global labor chains that make things possible.
Yes.
And the political moment is so much militating against making those easy already. I'm seeing in Britain now that they're bringing in people from Eastern Europe to harvest their crops right after Brexit, and no more freedom of movement and close the borders. And of course, we're in the same situation, and that most of the people who provide us with food are guest workers.
Yeah.
And we're really seeing disruptions along the food chain. Restaurants are closed, so people are plowing their crops back into the field.
Right.
That's happening all over Florida. We're going to see meat shortages because all of these meat plants are now having to close because, finally, after enough people die, it gets embarrassing.
I had not heard about meat plants closing.
Oh, really?
Yeah. Out in Iowa, I think in Nebraska, they've had to close some because, people work very close together in these places, and it's very fast-paced work. And so once the sickness gets in, it just kind of tears through these meat packing plants. But, the flip side of this is that, a piece just came out in the New York Times about how there's going to be world hunger. There's going to be starvation all over the world in the wake of this. There was already, a lot of places already had food insecurity, but this is creating a huge crisis, this and the various wars that people are pursuing. And we're plowing squash back into the field because we don't have restaurants to buy it. I mean, the whole thing is a little crazy.
Yeah. It's always been our problem is food distribution. not food production.
Yeah.
Yeah.
Yeah, it is.
Yeah, that's a good point. I mean, Malthus did not see this aspect of it coming.
Yeah, we've been doing this sort of been little project in my house is that we have somebody created an app for our county where restaurants and stores that have leftover food can post it on the app, and then you can volunteer to go pick it up and bring it to
That's
people. So there's a sort of local level redistribution, but at the global level, it's a lot more complicated. And if those restaurants stop being able to get their supplies, then that's not going to happen anymore.
Yeah. Nobody's going to be able to take these restaurant supplies to Syria, for example.
Yeah.
But yeah, we could certainly be doing more. I think Publix just said that they are going to try to purchase some of these farmers' products and give them to food banks. So that's huge.
Yeah, that's great.
Mm-hmm.
Yeah, it's scary to think about the long-term effects of this. And I almost feel like I can't quite think about it yet.
Mm-hmm. Me either.
I'm still in acute crisis mode. And then eventually, I guess I'm sure some people are thinking about it, but I haven't been yet.
Yeah.
And again, it's kind of weird because we're in acute crisis mode, but as it stretches on, and especially for those of us who are in communities that have not been hit quite as hard yet, so we're not visibly seeing it. It's not, in our families.
Yeah.
It's sort of hard to wrap one's head around that kind of crisis. And often, you see calls to altruism being very effective right during and immediately after a crisis. But once they stretch on, that becomes less effective. Leanne, you must see that. You must, have a lot of material on that.
Yeah. And I think it's interesting too to think about related factors like patience and degrees of separation, right? Like I think immediately before and immediately after, you don't necessarily have to worry so much about Publix being impatient because you're in the throes of that moment. But as we're in this for a few months, several months, I mean, longer than that, we just don't know yet. I think that's when the patience and the autonomy and the individual rights and, I mean, really individuals just lack of willingness to deal with it anymore. And I can't necessarily say that I blame them, right? This is a really rough time. So I understand the logic there. But then when it comes down to the campaign perspective, I think it goes from reshifting to try and find those more effective messages that I think are going to get at those populations who are pretty much at their wits' end. Like those who are just ready for it to be over with.
Mm-hmm.
Because it's like, okay, we're wearing masks. Masks are kind of a novel idea, right? So individuals are wearing masks for a week, 2 weeks, 3 weeks. But then it becomes a mandate, and then you end up having to wear a mask for, let's say, somewhere along the line of 6 months. Like, will the science behind it still be enough to get people to follow through with the mandate? Will the altruism at that point still be enough to get individuals to follow through with it? Or do we have to shift gears communicatively altogether at that point?
Yeah. I mean, masks have been sort of successfully adopted as winter flu season wear every year in lots of Asian countries. And I could see, as cute masks come out, with identity signs on them, I could see people getting sort of more used to that because that's an inconvenience. It's not a kind of life-altering inconvenience. But if we had to quarantine again, that would be harder.
Mm-hmm.
I don't know that we could achieve it. To think about the global unprecedentedness of the entire world basically being on lockdown. That's been my fear when I've seen more and more people out locally. I feel like I'm surprised that we had one shot to get everyone to stay home, and I don't know that we'll get another shot.
Mm.
Yeah.
Have any of you heard anything about fall courses at your universities? Do you think
they're still thinking about it? We're going to find out in July.
Yeah.
How about you?
We haven't heard yet. They're still considering the options.
Yeah.
But
we're online through the entire summer, and the summer schedule was pushed back a week. I mean, you can see they're sort of desperately playing for time, but
they've only called it for the first 2 summer sessions. They're still waiting on the last summer session and the fall. But I've heard from a lot of students feeling alarm at the idea of not going back in the fall in real life. But it does seem likely that we won't, I don't know. It's hard to.
Right. Yeah, it's shocking to have the reality set in that this likely will not be fixed by then, right?
Yeah, and it's hard to think. Yeah, I mean, it would certainly be a justifiable decision by the university to go all remote for fall, but
I mean, if this thing is still circulating, at the same levels, I don't necessarily want to be around 70, 18 to 22-year-olds that have just arrived from all over the place.
And I mean, maybe by then we'll have more serology, and maybe we'll have some ability to know if we had it already or something. I mean, I don't know. But we don't even know if that's directly effective. So, we don't even know if you get sustained immunity from having it. So,
right.
I don't know. I guess I'm just going to have to figure out how to use Blackboard Ultra. Probably the safest bet for now.
Yeah.
Well, we'll see. I mean, again, we're, with all the inconvenience, we're in the lucky situation that there are things that we can still do.
Absolutely. Yeah.
Amy Whitaker says, I'm hopeful for antibody tests. Me too.
That is, Amy is a biochemist. So even though she doesn't study this, I feel like maybe she knows better than us. I want to believe that.
In that case, her hopefulness really gives me hope.
Yeah. I'm hopeful too, because at least maybe then, certain people could have some level of safety or some level of comfort going back into work situations. But
Yeah. All right. Well, we're pushing 40 minutes and I've got another meeting coming up. So any final thoughts, or were those them?
Those were them. It's great to see you all.
Yeah. This is really, ever since Pamela, you said this is like the grounding point of your week, especially as we've gotten farther into quarantine. It's helped me because I have increasingly lost my sense of time and space.
Yeah.
So to have this in my Thursday, it's been really nice.
Yeah.
Yeah, same here.
All right. Thanks again, guys.
Thanks for starting it. All right.
Bye.
Take care, everyone.
Bye.
Thanks again for joining us for this episode of the Human Capital Innovations Podcast. I hope you stay healthy and safe and that you have a great week.